Good afternoon. My name is Pia Raanani. I'm professor of hematology at the Rabin Medical Center near Tel Aviv, Israel. And I'm here at ASH number 66. And I'm very happy to be here. It's been challenging times for us in Israel. And it's wonderful to be here again in meetings, seeing people a little bit away from all the bombs and all the difficult things we are undergoing. And I'd like to tell you a little bit about how it is to be a state under war for more than a year. A state under war, and how it is to be doctors in an academic institutes under 1 year of war. So there are several aspects. You know, the war came upon us just out of the blue sky. I mean, Israel has had many difficulties all over the years, but we didn't expect it to happen, and it happened on October 7th, out of the blue sky. So we had to recruit everything from ourselves, how to carry on with our lives as human beings and as medical staff. And I can tell you about several aspects. You know, there is a pyramid of Maslow, where you can live your life very basically for survivorship, fighting for survivorship, but you can also try to aim and keep on also the higher abilities, the intellectual part, and that's what we try to do. So, first of all, there is the survivorship, because actually we were physically threatened. It's not a war just going on in the front. It was a war that came also to us, to Tel Aviv, to the cities, and you have to carry on with your life, and suddenly you work, you treat a patient, you are in the operation room, you're in the catheterization room, you do a bone marrow biopsy, and suddenly there is a siren. So you have to throw everything and run into a shelter. So, or in the middle of the night, you don't have a full night's sleep because suddenly there are sirens, and not only in cities that are on the front, also in cities like Tel Aviv, like Haifa. So it's, first of all, the threat on your life. Second, we have the problem with the kidnapped, and it's all the time in the background. At first we had more than 250 kidnapped people. Now we have more than 100 kidnapped people. And on the one hand, we try to carry on with our lives, to go to the cinema, to go to the theater, but all the time in the back of the mind, we have those families, those people whom we know that they cannot take a shower, they don't eat. On the third part, we have as medics or as academic medics, there is a great deterioration in the relationship, in the international relationship, which means clinical trials. We have less clinical trials. We have to fight more for clinical trials because pharma companies don't want to come to Israel because they're not sure that there will be airplanes, that there will be flights to bring the medicines, because it's an unstable country. So we have to fight for clinical trials, while we were before at a very good place. Now we have to fight for it. Also, we have to carry on, and me as a head of a department, I want to carry on also with academic life. I don't want just to survive. But it's very difficult when somebody's husband or a father or brother is in the front and they're not sure when there will come the knock on the door telling them that something terrible happened. And it's very difficult for me as head of an institute to push the younger doctors to write, to do academic things that are beyond just treating the patients. And above all, there are the patients, because the patients, apart from their disease, which is life-threatening, they live under a daily stress when they watch television. So the level of stress is much higher. They are much more nervous when they come to the treatments. They are much more nervous with the secretaries, and the secretaries have their own problems. For example, one of my secretaries lost her brother during the war, but they still have to be patient toward the patients because they are the patient. So it's very, very complicated. And I have to say that for me, SOHO is one, we look for escapism all the time. So I go to concerts and I go to the theaters and I carry on with my work with SOHO. And last year also it was not easy for us to go, but I tried to force my young doctors to send abstracts, to go to SOHO, and it was great. It was great, and it was great meeting friends there and knowing that after all we're part of a community, and as academics and as doctors we have friends all over the world. So I want to thank SOHO for a long-lasting relationship always and especially during these difficult times.